All right, welcome back. Thank you so much for staying with us. It's Thursday. That means you're talking matters health, intimate health and well-being as a conversation you're having this morning. This is a medical conversation on rejuvenation for men and women. And Dr. Ashni Maldi, an aesthetic doctor, as well as the managing director, TIA, right? Tia is here for us to have this conversation, which focuses on intimate health and something that affects marriages, of course, confidence and overall well-being. Happy New Year and welcome back to Morning Cafe.
Thank you. Happy New Year.
All right, let's start from that particular point, intimate health. Why is it considered such an essential part of both physical and emotional well-being?
I think it just affects how, I'll say, just everyday life. Mm-hmm. It's normal to have intimate health. Mm-hmm. It's normal to be intimate. Mm-hmm. It's part of our body. Mm-hmm. It's part of anatomy. It's part of our need. Mm-hmm. And a lot of people consider it, I don't want to call it taboo, but consider wanting to just accept any problem in the body, not just intimate health, but let's say an example of knee pain. People want to accept it as, okay, this is part of my life, but you don't have to accept anything, and that's why we're here. That's why we're into regenerative medicine, because what we do is we help you regenerate your organs, your systems. And so we're just here to raise this awareness that don't accept anything as a problem and let it not become a lifestyle. And you must accept that intimate health is good, intimate health should be accepted, and work towards it.
All right. You've mentioned something about regenerative medicine. We'll build up on it as we continue. You've also talked about intimate health. Everybody aspires to be intimate. But when we talk about intimate health, many think it's all about aesthetics or just sexuality. But what does this field of intimate health and rejuvenation cover in a broader perspective, apart from it just being about sexuality?
So I'll go a little medical, and I'll explain how people suffer from urinary tract infections. Or people suffer from incontinence, which means that, often people can't hold the urine. And I'm just talking medically because these are literal common problems that a lot of men and women face. And so this is part of intimate health because that's what we rectify. And often people don't understand that there are solutions to it and live with it for such a long time and suffer. And of course, I would like to say sexual dysfunction as well. And so a lot of problems related around that. Yeah.
So what happens when, these intimate health concerns are ignored for a longer period of time? Does it affect, the mental health of, say, just a person, their overall body, how it works?
Definitely. We're talking as vast as infections, infections building up to become systemic, which means that it can flare up to the whole body, make you very sick. We're also talking about mental health, and it does affect you mentally. And so when you rectify it, or when you treat, I can't say you treat intimate health, but when you treat the problem, then it relieves you mentally as well. And so, we see that, a lot of people are affected mentally because, well, it's a vicious cycle. Stress builds up and stress relates to dysfunction. And then now that relates back to being, mentally disturbed. So it's just a cycle that goes on and on and on. And once you rectify the problem, then it sorts out a lot of issues, even mentally.
And we are aware that in many African societies, conversations around intimate health, like you alluded to it earlier, are avoided. Some consider it taboo, some are delayed. But from your experience, why do so many people suffer silently? And just instead of seeking medical advice quite early, we've normalized suffering. when we're talking about, our intimate health, then why would you say that we do not like just seeking medical attention as a people?
As you said, we've normalized it. And I'm right here just trying to not normalize it. And this is why we want to bring awareness, because, you have to accept it. But I think there's a lot of acceptance nowadays. A lot of, African culture or crowd is accepting it, getting educated, understanding that it's just not normal to suffer in silence. But yes, it is a problem. It's very hard for someone to walk into even just a doctor's office and describe this kind of a problem. And, I think that's something we all need to get out of. And is why I'm here to openly say that we are doctors, we are here to help you. It's so normal to come to us and talk to us about it. And we definitely have a solution for it.
So should any type of pain call for attention, or at what point should I sit down and say, now I have to consult a doctor and there's particular something that feels a little bit off in my intimate health?
Okay, so, everyone is quite well educated these days, and there's of course Google and ChatGPT. So we all know what are signs, we all know what are symptoms. So anything, like you said rightly, what feels off, then seek medical advice, because that's why we're here to help you. But yeah, any kind of pain, any kind of discomfort, definitely should be sought attention for. Yeah.
You mentioned something about regenerative medicine in healthcare, and this is something that we've talked about before. You mentioned it's how the body heals itself. You'll correct me if I'm wrong on that. But we also hear about growth factor concentrate when we're talking about regenerative medicine. Then how connected are these two when we're talking about intimate health?
So growth factor concentrate or growth factors are in your blood, and it's a part of regenerative medicine. Regenerative medicine is quite vast, but you did rightly say it, that it heals. You heal yourself. And so regeneration happens within the body. And so we're not doing anything externally. We don't use machines, we don't do surgery. We're basically just getting your own blood, your own growth factors, which are stem cells, and we inject them back in the intimate areas. And the reason we do that is because it regenerates the whole area. And when it does that, it's rebuilding the muscle, it's getting rid of, I would say, infections, only because when the muscles are stronger, then it's able to fight on its own. And when muscles are stronger, then performance becomes better, be it male or female. So all we're trying to do is just regenerate that area using your own blood, using your own stem cells. It's a matter of just 3 sessions, 1 session a month for 3 months. You're good for up to 2 to 3 years. You don't come back to us for 2 to 3 years. Doesn't mean that after 2 to 3 years you go back to square one. Of course, you maintain it, because what we've done is we've regenerated. So we've made it new again, and you just maintain it. And we advise you on how to maintain it. So when you come in for a consultation as a patient, we'll explain everything. You tell us your problem, we rectify the problem, and then you need to know how to maintain it, which we will advise you on as well. Yeah.
So it doesn't necessarily cure the problem, it just replaces it. Or just expound on that. Does it replace the damaged cells or cure it entirely?
So replacing damaged cells means curing it, because
permanently.
Yeah,
Okay.
you can say so. But of course, lifestyle matters, because if you're going to go out there and not take care of yourself, then it will get cured, but you'll just have a relapse. That's for anything in the body. Like I've often talked about how when we do regenerative medicine and we're regenerating your liver, but if you're going to go out there and be a chronic drinker, then you're going to relapse, because you're just nullifying the effect. And likewise for intimate health as well. If you take care, if you maintain, as I mentioned, Maintenance is low, as in maintenance is taking supplements, doing your Kegel exercises, just, all those basic things, then it doesn't relapse. So yes, we cure it.
All right, so how is this form of treatment different from, say, synthetic treatments or just hormone-based therapies? I know regenerative medicine has a lot to do with stem cells, but how entirely is it different from these, hormonal therapies?
So every different treatment, be it hormonal replacement therapy, be it medication, conventional ways of doing treatments, surgeries, every one of those treatments have different indications. More so like the patient is ideal for every kind of different treatment. I mean to say, you may be ideal for regenerative medicine, someone else may be ideal only for medication. So it's something that we decide upon a consultation. When you come in for a consultation, then we're able to tell you whether we can help you or not. And what is your problem, what is your expectation versus what we can deliver to you. But all in all, regenerative medicine does take care of 90% of the problems. It will, I wouldn't say it's a replacement of 90% of the treatments, but it's just as good as all other treatments. And the best part is it's natural and no side effects. And so we're just regenerating something from your own blood. So you also have nothing to lose. Yeah.
So there are no risk factors that somebody should be worried about, that if maybe they come for reconstruction or is it called reconstruction, or we just stick to regenerative? It's one and the same?
No, it's different. And I don't do reconstruction.
It's just regeneration, where stem cells are used. So do we say that the people you say the people who might have side effects, but some people who might not have side effects. So are there risk factors to this particular procedure that somebody should look out for?
Regenerative medicine has no side effects to start off with. No risk factors as well. We will only tell you if you're eligible or not. And if you're not eligible, that's it. And when I talk about eligibility, I'm just talking about can we rectify the problem or not? Or do you need a surgery? Or is it too bad that maybe nothing will help, unfortunately? That's the only criteria for eligibility. But otherwise, we literally can help 90% of our patients.
So why is the body's own healing mechanism such an important concept in modern medicine today?
Actually, our bodies are so powerful that we can heal ourselves without even us removing your stem cells and putting them back somewhere, for example. Because we have a strong immunity, because we have immune systems. And so when we're trying to say, regenerative medicine and functional medicine is, coming forward so much, it's only because we're trying to heal it the natural way, but we're supporting the body by bringing something out from your body and putting it back in your body. And so it's so important these days because we're also preventing rather than just curing. And no side effects, no drawbacks. Literally everyone is eligible for it, and nothing can go wrong. And so it's so necessary to embrace regenerative medicine. It's so necessary to embrace functional medicine because that's the way forward.
I want us now to go more into intimate health and well-being and just focus on women a little bit before we focus on the men as well, gender balance. Talk to us about some of the common intimate health concerns that women quietly experience, but we rarely talk about, especially after, say, childbirth or even menopause.
So I think a lot of people just accept the condition, be it dysfunction. When I say dysfunction, I mean to say pain, burning sensations, or let's say not being able to be satisfied. And these things are common problems. And, women don't understand that it's not normal to bear it. And there is a solution for it. But especially like menopausal women or even post-childbirth, as you said, you know, the area is quite sensitive. And so, of course, there's degeneration happening, degeneration that already happened, and we're just here to fix it. So when women, you know, face these issues, they must embrace it and they must seek medical help. And we're literally just regenerating the muscle back again, making the muscle stronger. And so you're able to have that, it's hard to put that word, but have enjoyment. And, you know, you don't have to have discomfort, basically. But I'll also talk about just general problems like urinary tract infections, UTIs, which is so common because we're all social, we travel a lot, we're using public washrooms, we're using washrooms in the offices. And it's something that's become so common because, you know, a lot of women are really sensitive these days. And people just suffer in silence because they don't know what to do about it. We'll try over-the-counter medicines, we'll abuse them, so to say, and then, you know, build resistance to it. And when you do that, then nothing works. And then it just keeps going on and on and on, and you just suffer. Or even older women I see who suffer from incontinence, which means that they can't hold the urine because, of course, the muscle has just become weak. So we're here to sort out such problems. And as I said, we're just rebuilding the muscle. So we're just regenerating that area. And so it's just making the area much stronger. Yeah.
So this growth factor constitute GFC. From a clinical perspective now, how does it address these symptoms such as, say, dryness, discomfort, reduced sensation in women? How do you do it for it to address such issues?
So it's very simple. Back to my point, when the muscle is stronger, it works. When your muscle is stronger, you can flex.
Yeah.
So just the same way, same concept. When the muscle is stronger, it contracts, relaxes, and it will just help to now just function better. Yeah.
So there's this widespread belief that these changes are simply, you know, part of womanhood and, you know, must be endured. Is that medically accurate from where you sit?
Yes, absolutely.
Yeah.
Absolutely. It is. And okay, we accept culture, and there's that big aspect of culture, and we're not trying to, you know, take women out of their culture, but you also don't have to suffer. So there shouldn't be pain, there shouldn't be discomfort, and that's what we're just basically trying to help you with.
So for men, intimate health challenges are often linked to stress, things like lifestyle, we have underlying medical conditions, but what issues do men most commonly present themselves with when they visit your clinic?
You know, unfortunately, I would say 70% of men above the age of 45 silently suffer, and they don't want to talk about it. And we understand where they come from, and it's hard for a man to just approach a doctor and say, look, I suffer. But it's a problem that a lot of men suffer and then just go by over-the-counter medications, and then we hear what happens after. And so basically, it's again just strengthening the muscle, helping men just to perform better. Yeah.
So what did their suffering look like? For women, you mentioned things like UTI, but for men, what are they?
Oh, again, it's just the same. Incontinence, of course, and dysfunction. And if you want me to elaborate dysfunction, then that's, you know, them not being able to last long enough, or men not being able to just perform, you know. So it really affects their mental health. And it's, like I said, a vicious cycle. Stress, non-performance, stress again. And so it's pretty much the same kind of problems, incontinence and dysfunction. Yeah.
When you say that men, maybe over the age of 45, they suffer silently, but at what point do you now have patients coming to you, you know, to address their issues? How do they get to that point? What symptoms do they come with? Is it just severe pain, or what is the push that brings them to the clinic?
No, men don't have a lot of pain, but they just come saying that they can't perform, and that's what's stressing them out. And so that's what drives them to come to us. And unfortunately, it's a very low percentage of men, because we have this concept of let's just buy over-the-counter medication and it works. And so a lot of men are just reliant on it, and then of course also abuse it at a certain point because they don't even know, they haven't even been advised how to take it. And so we're really trying to tell men that they must build that courage. Don't necessarily have to come to me because I'm a female doctor. I understand they feel uncomfortable, but male doctors, and we have a lot of male doctors. My co-director does growth factor concentrate. He's a male. And so it will help them to, embrace it. And so we have a very low percentage that come in, but yes, it's just when they're absolutely frustrated and they can't perform.
So for men, it's about just esteem issues. For women, it's all about pain. That's why they seek medical attention.
More so.
All right. What happens to the men if they do not seek medical attention as early as they should? In the long term, what does that do to their intimate health?
It doesn't really bring so much of a problem. Yes, of course, some concerns, it will bring larger problems, but otherwise it's just more mental. It's just stress, and I think, and then they just embrace it, and then they just lose the interest, and they also just lose the can we just say they lose that intimate health, because it dies down basically. So they just can't perform anymore. But so to say, in the long run, no such chronic problem per se. Yeah.
All right. Now that we talked about women and how growth factor concentrate works, for women, for men, how does this support blood flow, tissue integrity, and also nerve response in men?
So growth factors regenerate everything. Growth factors regenerate tissue, ligaments, cartilage, muscles, and of course when everything is regenerated, blood flow is improved, and so blood vessels become healthier, so to say in layman term. And so this overall, back to my square one point, when muscle is enhanced, when muscle is regenerated, then everything is just in function. And the core part of the organ is muscle for both men and women. And so when muscle is regenerated, then functionality is better.
So when muscle is stronger, function is better.
Yes.
Why does this regenerative approach appeal to men, say, who are cautious about dependency on medication?
Exactly. That's what I was also trying to say myself, that a lot of men just rely on over-the-counter medication. They're not advised on how to take it, is it good? They're also just dependent on it because it's now become a mental thing, like if I don't take the medication, then it's not going to work. And so we're trying to build that self-esteem, we're trying to build that confidence back in men. And then of course when we do regenerative medicine, when we inject the stem cells back in the area, the muscle builds up. We do help them with medication because we're trying to support it both ways. But so what happens is now we try to just make them accept mentally that they should be able to just be mentally stronger to be able to perform. And so we're trying to get off. I'm not saying that over-the-counter medications are a no-go. They are needed, but they're not always needed. And we want to reduce that dependency. We want to reduce the abuse. We want to, try and make men understand that they shouldn't be just taking the medication just because they feel they need it. They can heal themselves. Yeah.
So I want to take you back to that point where you say that, sometimes they do have to come back to you for medication in 3 years. We were talking about women. Is that the same for men as well?
Yes,
3 years.
absolutely. We're not casting in stone 3 years. It could be 2 years, it could be 3 years, it could be 5 years. It really depends on you as an individual. How are you maintaining? Have you resumed back to being intimate? Because remember, when it's functioning and when you're working on it, then it's working. It's just like a car, let's say. When you don't drive a car, then it's just going to rot. But when you keep driving the car, then it's going to keep working. And that's the same thing for men and women. So when you're going to continue driving, then it's going to work. But when you don't, then it's going to rot. So yeah, so there's no fixed timeline. It really depends. Are you taking supplements? Are you exercising? How is your weight? Are you controlling your weight? So there's a lot of factors that contribute to everything in the body, not just intimate health. But yes, these are the same factors for intimate health as well.
Great. So would you say intimate health can act as an early indicator of broader systemic health challenges?
Maybe for women, not so sure for men. So while we're having this conversation, I'd like to just emphasize that I'm not a specialist. I'm not a gynecologist. I'm not a urologist. So my specialty is stem cells. My specialty is regenerative medicine. And so I'm here just to emphasize on the fact that regenerative medicine is an aspect, is a concept that should be embraced when it comes to intimate health. And so I will only briefly say that yes, I've seen systemic issues in women, but not in men.
I want us to address this issue of stem cells issue now that you are a professional in that. It helps in the process of regeneration, but how are these stem cells harvested for the benefit of our viewer?
So from your blood, we just take your blood like a normal blood test. So it's very non-invasive, and we process your blood. It takes about 40 to 45 minutes to do so, and then we get your growth factors. So growth factors are a form of stem cells, and that's what's injected back in the body. That's one way of doing it. We also have something called peptides, and that's more functional medicine now. It's not regenerative medicine, but they work hand in hand. And so peptides are basically building blocks for amino acids, which are building blocks for muscle. This is just basic science that we learned in school. And so peptides are injected in the body, and it regenerates everything in the body. So we have specific peptides just for intimate health.
So what are some of these life modifications that should be adopted for successful stem cell therapy?
We don't drastically modify anyone's lifestyle, because I'm really trying to advocate someone to live their normal lifestyle in any kind of condition, not just for intimate health. But yeah, just the basics: eat right, exercise, be healthy. If you're overweight, then lose weight. We also have peptides for that, so we can help you all round. But yeah, that's just the basic. Have your supplements, nothing more.
So there's this notion that as we age, of course, our cells accumulate damage. I don't know if that is right. You're here, you'll tell me. And that eventually they enter a state of senescence. Is that how they call it?
Yeah.
Of course, then they are considered to be having, say, deficiencies, such that when injecting them into the problematic area, it ends up not performing as it should. Is that truly correct? Is age a factor when it comes to stem cell therapy or stem cell harvesting?
No. The reason being, your stem cells are, even though with age, don't age. So they don't degenerate. And so that's the most powerful factor in your blood. And that's why it takes us 45 minutes to process the blood, because we're basically getting the strongest of what's in your blood. And so it does not matter age, it does not matter ailments in the body. We're not getting anything weak. We've proven through tests that what we're getting is 100%, or I'll say at least 90% regenerative, which means that we're getting the strongest stem cells from your body, And there's a way that we process them, and that's how we ensure that it doesn't matter age, it doesn't matter platelet count, it doesn't matter immunity, it doesn't matter any kind of chronic ailments in the body. We will still be able to regenerate what we're trying to regenerate. So when I get your stem cells, no matter how sick you are, no matter how old you are, no matter what your platelet count is, I will still be able to regenerate the area I want to. Yeah.
So is it possible to harvest samples from newborn babies immediately they are born and maybe store them somewhere and use them later in life when they're older in cases where, say, a problem presents itself?
So these are some of the modalities that are used in the world. We don't do that in Kenya as of yet. I don't know if anyone does. I don't do that. I'm only using your own blood, and I'm only doing it then and there. I can only save it up to about 72 hours. So I can't harvest your stem cells when you were a baby and then use them on you later on in life. It's possible. There are facilities around the world that do that, but I think indications are different. But the biggest factor here is that price point. And so some of these extensive ways of harvesting stem cells and storing stem cells becomes really expensive. And it's also possible to get stem cells from another person and have them injected in you, as long as they're below the age of 22 or 23. But it's a super expensive procedure. And so we're always looking at cost factor. For me, I believe I want to always try and economize things for my patients, because we don't want things to be expensive. We want a larger crowd to be able to afford it. And so the growth factors that I do, or the stem cells that I do, are relatively affordable. And that's the major factor that we try to ensure that we modulate it in such a way. And we still have 99% efficacy. We still have 99% success rate. So it's good.
When you talk affordable, how much are we talking about as compared to what the global lens, price it at?
Specifically for intimate health and specifically for growth factors, we're talking 45,000 Kenya shillings a session and 3 sessions. So that's about 135,000 shillings. When we talk about peptides, we're roughly talking about 150,000 shillings, which is 1 cycle. So let me elaborate what 1 cycle means. 1 cycle is about 10 weeks. And that's it. You can stop for 10 weeks and resume again for 10 weeks, or you can be completely cured and you don't have to come back. Often in my experience, I see 1 cycle is enough. So you're roughly looking to spend anything between 135 to 150,000 when it comes to functional medicine, regenerative medicine. Not just for intimate health, this was an example. But let's say you want pain management, or you want hair regeneration, or you want skin regeneration, then it's roughly the same cost. Yeah.
So it's cheaper here as compared to if somebody decides to, say, fly outside the country to have that procedure?
Definitely. I think this is going to come out funny, but I'm the cheapest in the world. But yeah, it also depends on, if you're going to go for stem cell therapy where you're getting a 23-year-old stem cells injected in your body, that's going to cost you roughly 5 million shillings. So it also depends on the kind of treatment or the kind of stem cells, being injected in you. Yeah.
All right, let's go back to, intimate health, whatever we were talking about earlier. So is this form of treatment appropriate for both married and single adults, or does suitability depend more on the medical history of somebody?
Yes, of course, because like I said, we're trying to treat problems, but hey, prevention is better than cure. And like I said, you have nothing to lose. So if you want to just come and regenerate your muscle, just the way you'd want to come and do a PRP or a microneedling for your face because you want your face to glow more, there's no harm. So in relation to intimate health, there's no problem in doing it before being married, after being married, before having a problem, after having a problem. It's a personal choice.
All right. Who should not undergo regenerative intimate health treatments?
who should not.
Who should not, and why is proper screening so important?
I think the only contraindication we have is pregnant women and probably lactating women. But it really has nothing to do with even lactating women. But the only reason I would say that is because we use a numbing cream, and we generally prefer not to have anything enter the body during pregnancy and lactation, because it'll be passed on to the baby. But it's no such harm per se. If it's needed, we'll have to do it in certain conditions. But yeah, otherwise, no contraindication whatsoever.
Are there patients that you've turned back, when they come for this regenerative procedures? You told them that, you do not qualify for this.
Yes.
What type of patients are they? What do they have that make them, not to qualify for such procedures?
Either it may not be reversible for whatsoever reason, either too much damage, too old, or they're candidates for surgery, or it may just not work for whatsoever reason. Then is when we turn them down. But that's after understanding their medical history, after understanding their expectations, physically examining, and then giving them a way forward. Yeah.
So is it true that this intimate health can't be treated in isolation from the rest of the body?
What do you mean? Elaborate.
That, intimate health, they say that it can't be treated in isolation from the rest of the body. This is a question coming in for you. I don't know what they mean. That they say that intimate health connected to hormones, stress level, chronic conditions like diabetes, and overall lifestyle. So they cannot be treated in isolation.
They can. They can. Because it doesn't matter what other problems you have in the body. Everything can be concurrently treated, so there's no problem. Yeah.
So there's a question here for you, that can regenerative treatments be combined with counseling, nutrition, hormonal assessment, or lifestyle changes for better outcomes? And which patients benefit most from this integrated approach?
Definitely, combination of treatments, or a combination, or let's say, different kinds of approaches to one kind of problem is definitely necessary. So we're there to guide you, but like I said, I don't want to change your lifestyle so much. I want to help you while you living your normal lifestyle, and everybody's lifestyle is different. So I'm not going to push you to say, hey, look, just eat more proteins and more greens, or this is the way you should start thinking, this is the way, because that's not something you adapt to. You live your normal lifestyle while we treat you. And that's not just for intimate health, that's for everything. Even when it comes to losing weight, we don't, get you off your normal lifestyle, only because you're going to go back and then there's just going to be rebound. Yeah.
Let's touch on hair a little bit, the stem cells issue, because I know it's something that a lot of people might be interested in. That when you're talking about stem cells regenerating hair loss, are we talking complete hair loss or just small patches? To what extent can hair be restored when we're looking at stem cells?
So for hair, it's, again, we have to consult, but I'll give you a brief idea. If you have hair thinning, then stem cells work for you. But we're on our way to do some research. We're doing some clinical trials right now as we speak, whereby we're using peptides to regrow hair completely. And that might just be a complete change in the hair industry or the trichology industry, whereby we don't even have to go the hair transplant way of restoring hair or regenerating hair. And very soon, hopefully, in the next few months, we'll be able to just grow your hair by just giving you a few injections for a few weeks, and all your hair is back. Yeah.
I know a lot of people are going to be, happy with that particular information, because people are being told nowadays that, oh, you have a recessing hairline, or you're coming bald, something like that. But do you see us coming to a point where we are now more intimate, we're more, open about intimate health issues, just talking about it and exploring medical attention more? Do you see us getting out from that whole of cultural taboo-ish. Do you see us getting out of that?
Yes, definitely. Like I said in the beginning, a lot of patients now are very well educated, and they really know what they're looking out for. And it's such a good thing for us as doctors, because then we're able to treat you better, because we're not just breaking stereotypes or breaking stigmas. And so it's nice, because when patients embrace it, it's easier for us as doctors to treat it. And we really see that, positive attitude or positive, let's say, embracement from patients. And yeah, they are really accepting it. But like I said, we're really trying to push patients to embrace it even more. Don't be quiet about it. Talk about it. Come to us. We're there to help you.
So as we wind up this conversation, Dr. how can people differentiate between medical treatments and unsafe and regulated practices?
Come to us, do a consultation. Don't just buy over-the-counter medications. Don't just treat yourself by reading Google and ChatGPT, because we're here with more than 10, 15 years of experience, or even more for all our senior colleagues. And we know what we're doing, so you can't have read something for 5 minutes and then know all about it and even come and tell us how to treat you. And that's the reason we always say seek medical advice. Do a consultation. We're there to guide you in a consultation. Our consultations take more than an hour sometimes, because we're really explaining to you the whole process. We're understanding your problems. We're doing diagnostics. We're examining you. And then we'll be able to tell you the right, way forward. Yeah.
So where can we find Tier Clinic for somebody? You said you're the cheapest, for somebody who wants to come and just explore regenerative treatment.
I'm actually one of the first doctors to do regenerative medicine in the country. And yes, I do thank a lot of my colleagues who embrace regenerative medicine. But I really want to push more of my colleagues to embrace it, because it's a natural way forward, and it's the future in medicine. But Tia Clinics is in Mutaiga. We're just next to Gertrude's Hospital. You can look us up on all socials, and alternatively you can call us on 0799995716.
All right.
Yeah.
That is Dr. Ashni Maldi, an aesthetic doctor and, of course, managing director at Tier Medical Clinic. Thank you so much for making time. Happy New Year once again. You're talking to us about intimate health and well-being. This is a medical conversation on rejuvenation for men and women. There's a conversation that affects, marriages, confidence, and overall well-being. That brings us to the end of this conversation. This Health at Thursday. My name is Anne Odida. Good morning.